Thank you. We have a major challenge in our country with regard to health care, and we need to address it, and I support a number of reforms, but I do not support having national health insurance or a national health care system. The reason is that Americans want and need to have choice in the provision of their health care. And when you have only the government providing the health insurance, only the government paying the bills, they get to decide how much the doctors and hospitals and nurses are paid. They get to decide what's covered and what's not. They get to decide when you're going to get your treatment, because you're going to have fewer and fewer healthcare providers doing so when the government is paying their salary. That is going to be a serious problem. Instead, we should look to make healthcare more available by doing things like association health plans, where you have the opportunity for small businesses to band together and form large pools so they get the same risk ratings and lower rates that large employers get. You need to introduce more competition into the system so that employers can have more than one company offering to cover their employees, and the employees get to choose which plan works best for them with which company. They can make up the difference in the cost if they choose a more expensive plan, but that choice helps to hold down the cost. You also need to have greater emphasis on, and we're seeing it because we've already passed this into law, health savings accounts, where the individual has the opportunity to have a large amount of money put into an account. They have a major medical with a high deductible, and then they can choose what type of health care they want to receive, and they can have the opportunity to spend it. But it also matters to them how much they're paying for the various types of things they buy before they use up that deductible. We need to have litigation reform to cut down on the amount of defensive medicine that doctors and hospitals practice today, worried that they aren't giving enough tests and something shows up, even if it's very, very unlikely to occur, they're still going to pay for an expensive test to have it happen because they're worried about being sued in an unfair system.